Hey everybody, this is Ken from Learn English Through Translated Stories. Today I am visiting my friend Dr. Roberts, who works in a big hospital in New York. He will be taking us on a tour, showing us the hospital with its departments, so we will learn together all vocabulary and expressions needed in the hospital. Hopefully, you will not need them, but life is life. You might even need them to help a friend. And now, let us get started. My friend, Dr. Robert, was waiting for me by the main entrance where I met him. In front of the hospital, a couple of ambulances were waiting, equipped with medical equipment and paramedics who trained on first aid and quick health services usually stand by for any call from the operation room to bring any patient who is needed to be transported to the hospital. By the entrance, there is a reception area where people check in and get admitted to the hospital. Usually, this is the first thing you do when you go to the hospital. You will be met by the attending nurse or a receptionist who will give you a form. You need to fill in the patient form, which contains all the information about the patient. You may also need to fill another form if you have insurance that will cover your medical expenses. If your case is urgent, you will be admitted to the emergency room. If you, for example, are going to the hospital with a wound, the first thing they will do is they will stop the bleeding and disinfect the wound. Then they will start the actual treatment, as the case may be. So, they might end up stapling the wound, stitching it, or putting dressing on it. In more serious cases, they take you to the operation room if you are in need for a surgery. If your case is not urgent, you will be scheduled to be examined in a specialized clinic depending on your case. There are several specialized clinics in the hospital. Dermatology, where they treat all skin-related problems. Gynecology. This department investigates and treats problems of the female urinary tract and reproductive organs, such as endometritis, infertility, and incontinence. Nephrology. This department monitors and assesses patients with kidney, renal problems. Internal medicine. That is where they treat abdominal problems. ENT, ear, nose, and throat. That is for treating problems related to ear, nose, and throat. Urology. The urology department investigates all areas linked to kidney and bladder-based problems. Ophthalmology. Eye departments provide a range of ophthalmic services for adults and children. Nutrition and dietetics. In this department, trained dietitians and nutritionalists provide specialist advice on diet for hospital wards and outpatient clinics, forming part of a multidisciplinary team. There are some symptoms you should really know to be able to describe your case and tell your doctor what you feel. So, you might feel dizzy or weak. You might feel nauseous, want to throw up. You might feel sharp pain or blunt pain somewhere in your body. Sometimes you feel chest pain, or you might have broke something or have a cramp, or you might have bleeding somewhere in your body. In some cases, doctors of these clinics, after examination, give you medication or refer you to a consultant who has more experience or recommends a radiology scan for you. They might admit you to the inpatient department where you will be hospitalized. After full recovery, you will be discharged, either for the good or under a plan, and you might come back for consultation. So, patient final destination is the Discharge Lounge. Discharge Lounge. Many hospitals now have discharge lounges to help your final days in the hospital go smoothly. Patients who don't need to stay on the ward are transferred to the lounge on the day of discharge. Staff will inform the pharmacy, transport, and relatives of your transfer. To help pass the time, there are usually facilities such as a TV, radio, magazines, puzzles, books, and newspapers. If someone feels unwell while waiting, nurses contact a doctor to come and see you before discharge. This vocabulary tour, I hope you don't really need it in your life, but we always have to be prepared. Better safe than sorry. See you next time.